Hi everyone, we are about to do a role play here, and the setting for the role play is going to be a renal ward, and the patient has end stage renal disease. So let's see how that is going to be. So you ready?
Yes.
Let's go. This is the recording for the occupational English test. The test is held at Medcity International Academy on 23rd August 2021. Candidate name is Sangeeta and candidate number is 62374. Interlocutor is Jitesh and interlocutor number is 12345. The role play number 1, profession nursing. Good morning.
Good morning.
Can I see your identification number, please?
Yes, please.
All right, thank you. This is the test of your English language and not your professional knowledge. So speak naturally.
Okay.
All right. So this is going to be your role play card, and you would be given 3 minutes to prepare. And this is an extra piece of paper in case if you have to make any notes on. All right. Your time starts now.
Cute.
All right. Your 3 minutes preparation has completed. You ready?
Yes, I am.
You have 5 minutes to do the role play, and your time starts now.
Good morning, Mr. Michael.
Good morning.
How are you feeling today?
Nothing new, just the same.
Why? What happened? You were much better yesterday. Are you feeling really sad today?
Yeah, see, I've been thinking about my condition, and I don't find anything interesting or nothing to look forward to.
I perfectly understand, Mr. Michael, but I think if you could open up a little more about your fears, what exactly are your fears that you have? Probably that will help you better. Would you like to talk to me about that?
I don't know. See, I really think this dialysis is not going to work, and to be frank, I'm getting really irritated to undergo dialysis like thrice in a week, and I don't think I would end up getting a donor to get me the transplant, and I think we are wasting time.
Oh, Mr. Michael, don't say that. You've been brave so far. It's been a couple of months that you've been here, and I've seen you really being really brave. And I appreciate that. And let's continue that, because I understand when you say, dialysis is painful. It is. But this is a very, very important procedure, because trust me, if you don't take up dialysis, it's going to be even worse. And when thinking of all the issues or problems you might have if you do not opt for dialysis, taking up dialysis is much better.
Yeah, I know, but ever since I woke up this morning, the thing that is haunting me is I really think I'm wasting a lot of time and money, and what if I really don't get somebody to...
Oh, are you thinking about the donor?
Yeah.
I know you've been listed there for quite some time, but do not lose hope. Mr. Michael, I've been working in this hospital for the last 10 years, and I've been in the renal ward for the last 5 years, and I've seen different kinds of patients come here.
Okay.
And trust me, I've seen a donor turn up every time, and I'm sure that you will find one at the right time.
To be frank, that gives me a little bit of relief. But do you really think I have a chance?
Yes, definitely, because our hospital network is really wide. We've put up, all the notices wherever possible, and we are looking out for a donor. And soon, yes, we will have one. Do not worry about that. If that is what's, really at the back of your mind, I must say you should relax.
Yeah, that's one thing that has been bothering, and lately I've been thinking about my deaths really bad. See, what I would like to tell you is, it's more than something that I want to tell you. It's a demand that I would be nominated. It would be great if you could nominate me as not for resuscitation.
Oh.
Yeah.
All right, Mr. Michael. Did you think over it? Did you have a talk with somebody?
No, this is something that's been there in one part of, at one part of my my mind, and if, at some point of time, if I end up having a cardiac arrest, I don't want to be prolonged and dragged to life. I would prefer to be nominated as resuscitated.
I get exactly what you feel, and there are a lot of patients who are in similar condition who tell me about similar things. But would it be okay if I arrange a counseling session with one of our counselors? I know a really good one who's working with us here. She'll definitely be able to help you. It's not that I do not respect your decision or anything, but I want to make sure that you're well informed before making a decision. So probably talking to her a couple of minutes would definitely help you.
Yeah, okay. Do you think my frame of mind is not quite healthy?
No, definitely not.
Okay.
And like I said, you're being really brave with what you're going through.
Okay, thank you
I
so much.
see so many other patients, but you're putting a brave front. And I want you to continue doing that.
Okay.
You see, you have a supportive family. Your children come to see you every day. So you need to go ahead for them.
If someday, if I'm gonna die, I want to die with dignity, and I want all my family present when I die. Would you be able to?
Definitely, we understand and we respect all your decisions. But before you decide and finalize on the NFR, I would really like it if you can have a discussion or a talk with our counselor. Would that be okay?
Yeah, I think so. I wouldn't mind talking to her.
Yeah, and in spite of the conversation and the talk that you have, you still decide to continue. It's our hospital policy to have your request in writing.
Okay.
And we would want one of your family members to be present along with you when you do that. That's procedure.
Yeah, that's fine.
And we all of us here will respect your decision, whatever be it. But
Sangeeta, that's the end of your speaking time. That was a really good job.
Thank you.
Medcity International Academy. Trusted hands forever.